So, good morning, respected judges and colleagues. I am presenting a case of the case title is Optimizing Result of Chip Case by using Impella Mechanical Assist Device. I am from Bombay Hospital, Mumbai. So, we had a case. We had a case of a 54-year-old male who was a case of diabetes, hypertension, and he also had microadenoma of the pituitary gland, and he underwent multiple times lumbar punctures. And he was admitted on day 1 with history of 10 days prior. He had chest pain, breathing difficulty. He was admitted at a local hospital where he was diagnosed as anterior wall MI with cardiogenic shock. At that time, his LVEF was 35%, and he was given the heparin, dual antiplatelets, and then shifted to Bombay Hospital for further management. On admission at Bombay Hospital, the patient was conscious, oriented, vitals were stable. We planned to go ahead with his cardiac MRI, but unfortunately, patient was not cooperative for MRI. On day 6, patient developed new episode of chest pain, sweating. Patient deteriorated in the ward and desaturated at 10 am. Patient got intubated. His echo was done bedside, which showed no mechanical complications, and he was immediately shifted to cath lab for urgent revascularization. CAG was suggestive of mid-LAD 100% occlusion. So this was the echo done on bedside, which was showing a thin layered LV apical clot. This was bedside echo done. Then patient was shifted immediately to cath lab. So this was the angiography left side shoot, which was showing 100% occlusion of LAD. This is the right shoot, which was showing RCA looking normal. So the decision to put Impella mechanical assist device was immediately taken, and fortunately the patient's affordability was also good. So patient's relative consented for putting Impella device, and immediately Impella was arranged, and on table Impella device was first put. This is the picture showing Impella device getting put on the pigtail. This was the Impella device put, and in this case there was LV apical clot. The LV apical clot is a contraindication for putting Impella device. However, in this special case, we put Impella device keeping its distal end
क्या करे समझ नहीं आ रहा। एक तो टाइम भी कम है और इसकी मेडिकल हिस्ट्री भी नहीं पता। व्हाट शुड आई डू?
सर ये देखिए, इसके जेब से मुझे एक कार्ड मिला जिस पे कुछ हेल्थ कार्ड लिखा है। आई थिंक ये हमारे काम आ सकता है।
बट हाउ?
नमस्ते, आज हम आपके लिए लेकर आए हैं आनंद आरोग्य कार्ड। यह कार्ड नहीं, आपका पर्सनल हेल्थ कंपेनियन है। देखिए, इसमें एक विशेष क्यूआर कोड है, आपके हेल्थ का मैजिक कोड। जब आप स्कैन करेंगे, खुलेगी आपकी पूरी मेडिकल हिस्ट्री। इंस्टेंट एक्सेस, इंस्टेंट केयर, आरोग्य कार्ड, हर मेडिकल सवाल का इंस्टेंट जवाब। आपको मिले हुए आईडी और पासवर्ड का उपयोग करके लॉगिन करें। आपके रिपोर्ट्स या प्रेस्क्रिप्शन जोड़ने के लिए अपलोड पर क्लिक करें। इस तरह से आप आसानी से अपलोड कर सकते हैं। आपके रिपोर्ट्स को पीडीएफ स्वरूप में डाउनलोड करने के लिए डाउनलोड पर क्लिक करें। इस तरह से आप बड़ी आसानी से अपने रिपोर्ट्स को पीडीएफ फॉर्मेट में डाउनलोड कर सकते हैं। बिना लॉगिन किए रिपोर्ट्स डाउनलोड करने के लिए सिर्फ कार्ड के पीछे का क्यूआर कोड स्कैन करें। आपके परिवार के डॉक्टर भी इसका उपयोग करके आपके निर्धारित उपचार के लिए प्रेस्क्रिप्शन अपलोड कर सकते हैं। अपना आनंद आरोग्य कार्ड प्राप्त करने के लिए दिए गए नंबर पर संदेश भेजें। आज ही अपना खुद का आनंद आरोग्य कार्ड बनवा लीजिए और नए भविष्य में कदम रखें।
From the minute we're born, we're aging. Constant exposure to our environment, the things we eat, and stresses from both inside and outside our bodies all cause us to age over time. Aging is highly complex, but scientists are starting to understand what happens at the cellular and molecular levels. For example, healthy cells are damaged over time when our immune systems shift from reacting to short-term problems like injuries and infections to gradually producing chronic inflammation throughout the body. Time also gradually shortens the telomeres that act as protective caps for our DNA-containing chromosomes. These and other changes make our bodies less and less able to deal with stresses from inside and outside of our body. So when damage reaches a critical level, our cells, tissues, and organs may no longer perform normally, and our health starts to decline. The changes associated with aging start to happen on some level at day one. We begin to experience their effects early in life. For example, we lose the ability to hear certain high-frequency sounds as teenagers. Our cognition and memory slowly decline after they peak in our mid-20s. The strength of our bones starts to decrease in our 30s. Female fertility sharply declines after 35. Age-related nearsightedness begins in our mid-40s. And our hair starts to gray and thin as early as our 30s and 40s. After the age of 50, the changes of aging become increasingly noticeable. And because aging is the biggest risk factor for most of the diseases that affect us as adults, the older we get, the higher our risk of chronic disease becomes. While scientists have not yet found a way to stop these processes of aging, they are learning more and more about how to maintain health throughout our lives. Some aspects of aging are out of our control, like our genetics and our family history, but we can educate ourselves about moderate risk factors and do our best to reduce them through healthy lifestyle and diet choices. Most of us can be healthy and active well into our later years if we take care of ourselves. It's no surprise that regular physical activity can help maintain a healthy weight, improve moods and sleep habits, and boost overall health. And it's clear that a well-balanced diet full of nutritious foods is critical to good health. But when it comes to understanding which foods are the best choices, much nutrition research has focused on how certain foods or nutrients may have a negative effect on health or even play a role in disease development. More recently, scientists have begun to explore and understand how nutrition may play a role in promoting healthy aging throughout all of life's stages. We are rapidly learning about what foods and nutrients should be emphasized in our diets and how they can enhance our health. Diets full of fruits and veggies, whole grains, legumes, nuts, and lean meats have proven health benefits like lowering blood pressure, improving glucose control in diabetes, weight loss, improving arthritis, and reducing the risk of cancer and cardiovascular events, to name a few. And we are learning more about the specific nutrients that can impact health. For example, plant pigments found in bright orange and red fruits and vegetables may prevent and slow the progression of eye diseases. Calcium helps to keep bones strong. B vitamins play a role in maintaining brain health. And flavonoids from many plants may improve the health of our cardiovascular systems. The bottom line is that you have the power to maintain and improve your health, add vitality to your years, and reduce your risk of disease. And it's never too late to make a change. To learn more about the nutrients that are critical to your health and how to safely turn to supplements if you aren't getting enough of these nutrients in your diet, watch Healthy Aging with Nutrition at www.agingresearch.org/nutrition.